The last lecture in this video series on Doppler will cover color Doppler. So what is our color flow Doppler? Well, color flow Doppler displays velocity information that gets superimposed onto a 2D image. So typically we find our nice black and white picture, we activate color box will come up, and the color box is going to identify movement. Typically we use it for movement of blood. So that color flow is going to provide information and the location of flow. So color flow Doppler uses pulsed ultrasound technique because we get to pick where we want the information coming back from. We have range resolution with it. But because we use that pulse wave technique, it's going to be subject to aliasing. The nice part about color flow Doppler is that it is not as dependent on angle as pulse wave or continuous wave are, because it's more of a semi-quantitative information that we're getting back. It kind of gives us an averaging of velocities that are coming back, so we're not as dependent on that angle, where when we want true velocities, we need exact angles. And then again, color Doppler does give us that average velocity of the area that we are interrogating, where pulse wave and continuous wave are going to report peak velocities. Alright, so as we are scanning in our black and white, we want to see how blood is moving through vessels or through tissue. We will turn on our color, and usually a box comes up, and within our picture we'll get our blood flow superimposed over a black and white picture. When we pull up our color map, we'll usually get one box with some reds, maybe little yellows in there, and then we'll have that black bar in the middle, and on the other side we'll have blues with maybe a little bit of green on the one end. These are color maps that pop up in the corner. The color map assigns measured velocities into the colors. Usually we'll see a number on either side. Reds typically represent, or whatever's above the baseline, which is that black bar, will be blood vessels that are traveling towards the transducer, giving us that positive Doppler shift. Anything displayed as blue then is moving away from the transducer, or our negative Doppler shift. Clinically, we typically like to display our arteries as red and our veins as blue. If, for whatever reason, they are traveling in a different direction than what our map is telling us, then we can simply invert, making our blues our positive shift and our reds our negative shift, keeping that black bar in the middle. There are two dictionaries that color maps can pull from. Those are discussed on the next slide. So the two dictionaries are velocity mode and variance map. The velocity mode is going to tell us the flow direction and velocity about, because remember, color kind of gives us the average of velocities. So if we have our color map, our black bar in the middle, blues on the bottom, and then we're going to see a number off to the side. These are going to tell us our velocities. At the area that is black, this is considered 0, or our baseline. This is where there are no Doppler shifts occurring. This is going to occur anywhere that the angle is 90 degrees to the beam. And then of course we're going to have our reds and our blues based on how the Doppler equation works with items moving away or towards the transducer. The variance map is kind of similar, but the variance map is going to not only tell us flow direction and velocity, it's also going to tell us laminar and turbulent flow. So again, we'll have our red on one side, our black bar in the middle representing that 0, and then blue on the other side. The difference with this, though, is that on the left side of our box, we're going to have laminar flow represented. And those are typically represented with a little bit more solid colors. And then as we get over towards the right side of the box, where the color starts to change, we're going to see turbulent flow on the right. So remember, left LL, left laminar, right turbulent flow. So here's a better picture of what we were talking about than what I was able to draw. This is our velocity mode tells us velocity and direction. It says that these are going towards the transducer and are maybe about half of 73, so about 36 centimeters per second, where anything displayed down here or in this blue range is going away from the transducer, again maybe about half of 73, so about negative 36 centimeters per second. That's our velocity mode. Speed and direction, that's all we're getting out of that, away or towards. Variance mode is not only going to tell us velocity and direction, but it's also going to tell us laminar and turbulent. So if we were to get this display in a blood vessel, we would expect that the area in red was maybe about half of this, and laminar, because it's on the left side. As it switches to that more yellow color, we're going to start to think turbulent flow, because that's matching up with the turbulent right side of our color variance mode. So again, remember LL, left laminar. The bluer or the redder it is, the more laminar flow it is. As it turns into greens and yellows, we're going to see more turbulent flow. So because we're using a pulse wave transducer to get our color Doppler information back, Color Doppler is also subject to aliasing. It's important though to recognize aliasing versus true flow reversal. So with aliasing, it's kind of the same concept as we got with the pulse wave. We have our color box with our area or our baseline that's represented as the black bar, and then some colors below. This up here, this number is our Nyquist limit. And so if any colors or any velocities exceed that Nyquist limit, they are no longer going to be displayed as red, but rather wrap back around and be displayed as blues. So we get aliasing with high velocities, just like we do with pulse wave Doppler. The difference though is that we are going to have reds that turn into yellows, that turn into greens, and then back into deeper blues, because we're getting that wraparound effect. When we have flow reversal, again, we're going to have our bar here, our black baseline, and our blue. If we have a red in our vessel separated by a black, and then back into a deep blue, this is going to be true flow reversal, because it is coming across that zero baseline and going into a negative flow. So these pictures do a good job at showing us what we're kind of looking at. This top picture does show us aliasing. We've got red moving into yellows, moving into greens, and then ending up in blues. So we can see that the flow has gone from reds to yellows, wrapped back around into greens, and ending at blues. This is true aliasing. When we have flow reversal, you can see in our picture here, we start with blues, cross a black line, and then go straight into reds. That is representing right at that zero baseline. So this is true flow reversal. We can also see in our spectral tracing that we have positive flow, negative flow, positive flow. So we're catching this waveform right as it's crossing over that baseline. Just as it is important with pulse wave Doppler that we are changing our PRF scale, it is going to be important to do the same with our color velocity scale or our color PRF. If we were to set our PRF very high, say at 69 centimeters per second for the portal vein, it's going to look as if there's no flow within that portal vein. If we set our color velocity scale appropriately to maybe about 30 centimeters per second, we're going to get nice wall-to-wall fill in our vessel. That's what we expect to see. The other problem is that we can decrease our scale too much, and at that point we are going to start to see more aliasing. We still have wall-to-wall fill, but now we're making it look like the blood is flowing very fast through there. So it'll be appropriate to set your color scale for the speed of the blood that is traveling through the vessel that we're looking at. The information that the ultrasound machine sends out into the body to get the color information back are sent out as Doppler packets, which are also known as ensembles. So remember, ensemble, the same as a Doppler packet. What ends up happening then is that the ultrasound pulses that the machine sends out are used to determine the blood velocities. When we send out large packets, we're going to get more accurate velocity measurements, and we're going to increase sensitivity to that slow flow. The problem is when we send out those large packets is that we're going to need more time to acquire that data because we're sending out so many extra ultrasound pulses. With that, we get a reduced frame rate and a decreased temporal resolution. So next time you're using color, take a look at what having a small box compared to a larger box does to your temporal resolution and your frame rate. Your small box was only going to use a few Doppler packets to get that information. Your larger box will use quite a few more ultrasound pulses, which means it's a larger packet or a larger ensemble, but it's going to give us more data back. So you need to consider the size of your box and how it relates to the Doppler packets that are being used to collect the color information from within that box. Another technology that we have available to us in the realm of color is called Power Doppler. So Power Doppler is used again to detect movement, but in this case it only identifies the presence of a shift. It doesn't tell us the speed and it doesn't tell us the direction. It can just say, hey, yep, there's something moving here. Here's the intensity of it. Power Doppler is also known as energy mode or color angio. And again, it only tells us the amplitude in regards to the number of moving blood cells. The advantages of Power Doppler is that it has really increased sensitivity. It can detect very slow flow or very small amounts of red blood cells that are moving through tiny, tiny vessels. It's also unaffected by angle unless we're at that 90-degree angle where we're not going to get any Doppler shift recorded. And then Power Doppler also does not alias because velocity info isn't processed. So Power Doppler actually has a lot of clinical use, but as far as recording velocities, it's not going to help us in that sense. Disadvantages of Power Doppler is that, again, we can't get measurement of velocities or direction. It's going to take more time to create Power Doppler because we're sending out a lot of pulses to get it, so our frame rates are going to decrease as well as our temporal resolution. And then it's going to be more susceptible to motion of the transducer or a patient. As you use Color Doppler or Power Doppler and the patient were to cough or maybe a gas bubble were to go by, you're going to get these big bursts of color or flash artifact. And it's just going to be a lot more sensitive. It's not always going to show us true movement that's occurring. So in this picture here we have two pictures of the kidneys, and the left picture is showing us Power Doppler, and you can see the color map on the side here has kind of dark brown reds all the way through really bright yellows. These again are showing us amplitude of the motion that is happening within the vessels. So we're having very high amplitudes through the middle of these vessels, lower amplitudes towards the outer smaller vessels. Again, Power Doppler is going to be very sensitive to any sort of movement, so we're going to get nice fill in where we might not typically see it with our Color Doppler. Color Doppler is on the right side here. We can see our color map up on the side here. We have now introduced velocities, as you can see 11 and negative 11 on here. It's also telling us direction that Power Doppler couldn't tell us. A lot of the tips for optimizing your Color Doppler are going to overlap with optimizing pulse wave Doppler as well. So the first one being normal incidence. Again, remember, we're not going to recognize a Doppler shift if we are perpendicular to our ultrasound beam. So if this is our beam coming down, anything traveling directly perpendicular to that beam is not going to be displayed as a Doppler shift. We have to be coming in at some sort of angle. So make sure when you open up your box that you are not always at a straight up and down box. We're going to want to induce some sort of angle on our color box so we can get a horizontal vessel to fill with color. Echo, you guys have the nice advantage that most of your windows are always putting you at a 0-degree incidence, so you almost will never really change the angle of your box, but you may swing it off to one side or the other to try to get some better color fill through a certain area. Make sure your Color Doppler gain is set appropriately. If we turn it up too high, we're going to start to get that ghosting or that cluttering outside of the vessel. If we turn it down too low, we're going to lose the velocity information. It's going to be inaccurate. We're going to make it look like flow is not occurring, even though it should be. Aliasing is part of using that pulse wave to create the color Doppler. So when we have aliasing occurring in our color pictures, we're inaccurately assigning colors. It can also be corrected the same way all the pulse wave aliasing can be corrected as well, increasing your PRF, getting closer to the vessel that you want to interrogate, changing your baseline, and changing transducer frequencies. Continuous wave Dopplers, however, don't really do color, so that's not an option for color Doppler. We can also change our wall filter. We have a wall filter separate for the color Doppler function. Increasing the wall filter is going to eliminate those low velocities, so we are going to clear up that extra little information that might be occurring in blood vessels. However, if we increase the wall filter too much, then we're going to start to lose velocity information. The biggest thing that you are going to change with color is most likely your PRF, which is the same as scale. So when we say increase or decrease your scale or increase or decrease your PRF, you're going to be able to eliminate that aliasing and change how sensitive the color is to velocities that are flowing through the blood vessels. So a little bit more on color steering. Again, it's going to be important that we're never coming in at that 90-degree incidence. It's best to come at some sort of angle, 0 being the best, but anywhere between 0 and 89 is going to give us at least some color information. So in our picture of our vessels here, we would never want our box to be straight up and down. These vessels would look black. We would not get any information out of there. So we want to make sure that we have some sort of angle on our vessels to get that nice color fill. Again, Echo, you guys have that nice 0-degree incidence almost from all of your windows, and that's typically where we're going to do our color and where we're going to get our pulse wave information out of. So you guys don't have to worry about it as much, but you do still need to know about it for your physics boards. Depending on how we steer our color box, it will fill the vessel in different ways. So if we can have a nice small angle, as we do with this first one here, we're getting really nice wall-to-wall color fill. It's a very strong signal that's returning, so this is a very nice image. Same angle, or same vessel, if we were to angle our box more up and down, the vessel itself still has an angle, so we are still coming in an angle, but not as small of an angle as we were previously. So we are still going to recognize that there's flow through there, but we're not going to optimize the color that is going through that vessel. As we keep rotating our angle box around, if we start to come in too large of an angle or start getting really close to that 90-degree incidence, we're going to start to really lose a lot of that color information from our vessel. Again, make sure that we are setting our color gain appropriately. If we turn it up too high, we're going to start getting all this junk outside of our actual vessels. What we might be obscuring is some true disease or pathology that's going on within this vessel. We would never know because our gain is set too high. Even this over here, we've got a little bit of bleeding outside of our vessel wall. We want to make sure that we are reducing our gain enough so flow is only where we expect flow to be, which is within those vessels. Again, adjusting the color wall filter will also help you to fill your vessels wall to wall and be sensitive enough to low flow or to reduce that extra low flow that we don't want. So in our first example here, our wall filter is a little too high. We can see that there is a gap in between the wall and where we are getting color information from. That is because, as we've learned previously with laminar flow, we've got slower velocities out towards the walls. So the filter has been set too high and the machine just isn't displaying that information. So we want to make sure that our filter is set appropriately so we get nice wall-to-wall fill without it going over the borders. A big part of our job as well is to recognize is blood flowing in the right direction. So the first thing that you will need to recognize what vessel am I looking at and which direction do I expect it to be heading? Right to left, left to right, towards the transducer, away from the transducer. All of this you should kind of be able to figure out in your mind before you even set the transducer down. Once you set your picture down, or set your probe down and you put your color on and get a picture, then you're going to start looking at your color map and try to determine, is the blood flow going in the right direction? So this first example here, blue is assigned as towards the transducer, so blood is flowing in this direction and then taking a turn and moving away. So this is appropriate blood flow. It is not aliasing because we have that black bar in between. It's a true change in direction of blood flow. We can check out another example here. We have blood moving through this vessel towards the transducer, so we expect to see it going this way. That matches with our towards. That is correct for this vessel. Another example, within the heart here we have a jet coming off, and we are determining, is this flowing towards the transducer or away from the transducer? We see that it is blue. Blue is assigned away in this example, but in our spectral waveform we have it on this side of the baseline. So you need to make sure that everything kind of matches up, invert if you need to, adjust as you need to, so it makes sense for yourself and also makes sense for your reading doctor or radiologist. Another example here, we have two blood vessels. One is traveling towards the transducer, as assumed by the red here, and one is technically traveling away from the transducer by the blue here. So we just want to make sure that things match up with what we expect. So there are a few examples in this one. Try to figure this one out for yourself. Which direction is this blood vessel flowing, away or towards? It is flowing away, which means that the blood is flowing from the right of the screen to the left of the screen. Which, by the way, is normal for the common carotid artery. What about this picture? This one is kind of all over the place, and sometimes we get snaky vessels and we need to figure out, are we seeing aliasing? Are we seeing true reversal of flow? Is something going on? Is this pathology? We have to be able to figure that out. So let's look at this one. We've got red is going towards, so the blood flow is going this way. This is flowing away. Back that up. We have red is flowing away from the transducer and blue is flowing towards. So we're traveling this direction, and the blood is traveling towards while it's in the blue, and then away again in the red. We can see red crossing over black and turning into blue, so this is true change in direction. Again, crossing over black, changing direction. This was the common carotid artery, brain up here, heart down here. This would be flowing in the correct direction. As we talked about before with autocorrelation and the fast Fourier transform, these are technologies that the machine uses to help determine the velocities that are occurring and if they are traveling towards or away from the transducer. So autocorrelation is also known as the correlation function. And again, this is going to be just a vocabulary term that you will need to know that helps the machine figure out how to display color flow Doppler. Autocorrelation is actually very similar to the fast Fourier transform. It is, however, less accurate but faster. And what it does is it recognizes the main velocity of those complex returned echoes and assigns a color in accordance to the color map. So again, let's say we've got this group of blood vessels here, and it wants to assign this red. We have another group of blood vessels, and those are going really fast, so the machine thinks it should be assigned yellow. And then we have this other group of blood vessels that are going kind of in between and wants to assign it that color. It's going to take all of this information and then display in our blood vessel the correct color for all that information that is coming back. So that is the autocorrelation. Again, less accurate than fast Fourier transform, but much faster, which is helpful for maintaining our temporal resolution while we have color on. Alright, so kind of another big lecture, but there's just so much information to really get out there about pulse wave Doppler and color Doppler and the whole Doppler process. For vascular students, a lot of this has probably been reviewed for you based off of your vascular class. For echo students, I believe you've also had quite the introduction to Doppler. But the biggest part to pull out of this color Doppler lecture is just to recognize that aliasing occurs with color Doppler as well, that there are certain ways that we can fix color Doppler, and the technologies that we have within the machine to kind of optimize it, being changing our PRF, changing our color gain, changing wall filter, and then knowing what packets are and how they affect our temporal resolution. If we use large packets, are also known as ensembles, and then knowing that autocorrelation is the way that the machine figures out what color to display in the vessels. So number 1, describe velocity and variance mode color maps. Number 2, how can we tell the difference between aliasing and flow reversal? Number 3, what are Doppler packets also known as? What are the advantages and disadvantages of large packets? Number 4, what is power Doppler also known as, and how does it vary from color Doppler? Number 5, what tool do color Doppler instruments use to determine Doppler shifts? And number 6, again, what questions do you have about this lecture? These are some YouTube videos that I have found helpful on the internet that you may want to look at for your own personal information. You will not be responsible for anything on these YouTube videos, but I find that going through the lecture piece of it and then reading your books and maybe doing some research on your own might help to explain concepts even further for you if you want some more information. The first link is a quick one just on like Doppler in general. The last link is quite a bit longer Doppler equation video, but it really goes into the math of the Doppler equation, and it's geared towards ultrasound, so it might prove to be helpful for you.